Hi everyone, it's Yvette McQueen, MD. I'm an emergency physician and the travel doc. My goal is to help you travel well. With my tips, you can travel healthy, efficiently, and safely to enjoy those adventures, new experiences, and vacation. You can follow me on all social media, Facebook, Twitter, Instagram, Snapchat, Google Plus, and YouTube at Yvette McQueen MD. That's Yvette YVETTEMCQUEEN MD. So today I'm going to talk about I'm going to talk about a topic I discussed earlier in the year, but because of a recent article about a young lady who went to the emergency room several times with difficulty breathing, chest hurting, and she ended up having a blood clot and dying. So this is a little bit medical and about travel. So are you at risk for a blood clot? As emergency physicians, I do see blood clots and pulmonary embolism, that's blood clot to the lungs, multiple times. So if you know you're at risk, things that make you at risk, or what we say more higher potential or more likely to actually get a blood clot. If you travel a lot and you are sitting more than 2 hours at a time, and that's on a plane, train, or car, you are at risk if you are obese. You are at risk if you're a female that smoke and take birth control pills. You are at risk if you have been immobile for a period of time after, say, a surgery or a break of the leg or the arm, anything that will cause decrease of your normal daily activity where you're just sitting around for a long period of time, you are at risk. You are at risk if you are a cancer patient. You are at risk if you are pregnant. That increases your thickness of the blood. And basically, if you breathe, you are at risk. So it can happen to anybody at any time. But those are the conditions that make you more likely to develop a blood clot. So what are some of the signs and symptoms that you should watch for? So blood clots typically form in your lower leg, in your calf region, and also in the lower part of the thigh. That's where we see them. We sometimes call it a DVT, or deep vein thrombosis. You may hear that DVT, you can hear that a lot, but you can get a blood clot there. What happens generally is it usually happens in one leg more than the other, not both sides. It can happen in both sides, but typically or usually we see it just in one leg, where your leg becomes swollen. One leg is 2 to 3 size of the other leg. It's very firm to the touch. It can be warm to the touch, tender when you squeeze your calf muscle, or right above the knee. It's very tender, and it hurts to walk on it. What we are mostly concerned of is if you develop a blood clot in the leg, pieces of it can break off and travel to the lung. And it's at that point it affects how much oxygen you get and how you can breathe. So that's when we call it a pulmonary embolism, or a PE. Signs of that you will see where you can't breathe. You feel like you just can't catch your breath. You're just always trying to get your breath. You may have some chest pain, and this chest pain is going to be a little bit different than when we think about the heart, because usually it's a sharp chest pain, it's an intense chest pain, it's a pain when you take a deep breath. And it hurts. It just hurts to breathe. So then you stop breathing, you stop taking deeper breaths. You also notice that you breathe faster, almost like a panting, trying to catch that breath. And also you notice that your heart rate can be high. So a little bonus here. The bonus is how to check your heart rate. So you have your wrist. You take your hand when you find your thumb, and you take 2 fingers and follow the thumb down past the wrist to the groove. And your 2 fingers are in that groove, and you check for your heart rate. So what you do at that point is you count for a whole minute. Okay. Hi, Dr. Pam. So you count for a whole minute of your heart rate. Normal heart rate should be 60 to 100 in the normal person. Now there's instances where it's lower. It may be under 60 if you're athlete, marathon runner, or you're taking medicine. But it takes usually 60 beats of the heart to pump blood to the brain so that you can think and breathe and things like that. If it's lower than that and you're not on what we call beta blockers to reduce your heart rate, or you're not an athlete, then you should probably see a medical professional. Of course, if it's 30, we worry about that. Trust me, we worry about it. Just call 911 at that point. Especially it comes with chest pain. So if it's over 100, your heart rate is usually over 100 when there's things like a high fever, or hi, Dr. Leslie. When it's a high fever, when you're sick, even in this instance, when I'm talking about blood clots, you would have a heart rate over 100. So that's a bonus of figuring out when your heart rate is abnormal. So back to the blood clots. So you, once again, I told you, you won't be able to catch your breath. You have that sharp pain when you breathe in deeply. You just feel ill and fatigued and just feel like you can't to go to the emergency room. As an emergency physician, I don't say that lightly, but you need to go to the emergency room because you need to figure out if you do have that blood clot. And there's different tests that can't be done in your doctor's office to find out if you have that blood clot, either in the legs or in the lung. So if you're thinking in the legs, they need to do an ultrasound of your legs, or they would do a CAT scan of your chest. And they also would take some blood work to find out different levels. So that's very important to make sure you don't have that blood clot. So again, are you at risk? You are at risk. If you're breathing, you're at risk. Okay, that's settled. But you have a higher availability or a higher potential to actually get a blood clot. If you're traveling a lot, sitting more than 2 hours at a time in a plane, train, a car, if you're immobile due to surgery or a broken bone, if you're pregnant, if you have cancer, if you're obese, and also I didn't say before, if you have a family history of blood clots, you're at risk for that too. And of course, the female that smokes and take birth control pills, you are at risk. You have a higher potential or a high ability to get a blood clot. And those signs you should look for: that one leg swollen than the other, hot to the touch, hard to the touch, it hurts to walk on it, you can't catch your breath, you have sharp chest pain. Please, please, please go to your nearest, someone keeps calling and interrupting, sorry. Go to your nearest emergency room and have them tested and say, I think I may have a blood clot. Tell them that I had these symptoms and I've been traveling a lot, or this is why that I'm higher risk. Because unfortunately, as an emergency physician, as I said before, blood clots can be deadly. It can happen from young to old, but it is preventable. And so check out if you're at risk. If you have those symptoms, go to the ER. So this is Yvette McQueen, MD, your travel doc. You can find me on all the social medias at YVE TTEMCQUEENMD. Okay, enjoy your vacations, your travel, and ciao for now. Peace.